We're here in Pure Plastic Surgery, back with Tuesday Tips. Thank you so much for joining. We tend to meet every Tuesday afternoon to discuss different topics in plastic surgery, and I get to answer your questions. Thank you so much for all the questions that you sent. I'll get to those after we finish the little talk. I tried to make that short, but if you have any questions or you want me to go into more detail of any of the things that I'm discussing, I'm more than glad to do so. The topic today is a very hot topic. I get this question a lot, and you probably can find some lives that I've done in the past talking about this. But since I've got this question in some of my comments and in the question box that I put over and over during the past few weeks to months, I just decided let's do this again, and I brought in some pictures because I think showing you guys some pictures of real patients and what had happened after liposuction to their skin and why, I think it's important so you can visualize it. So the million-dollar question is, what do I need? It's liposuction or a tummy tuck. I really don't want the tummy tuck. Can I just do liposuction and it'll be okay? So let's start by defining what is what, okay? And what is going to help us understand what are you a candidate for, okay? So let's start by just talking about anatomy, talking about not talking about the procedures, but talking about the abdomen, the layers of the abdomen that we all have, okay? So these are mainly the layers, very superficially, very simply explained. We have the skin, which is this more external layer. Okay. This external layer. What's depicted here in blue is the subcutaneous fat. So the subcutaneous fat is the fat that is between the skin and the muscle. Here, this purple line in the center, that's the muscle, and the pink is the visceral fat. So we talk a lot about what's subcutaneous and what's visceral. So what divides those two things is the muscle, and the visceral fat is around our organs. So when I tell patients you do have a large component of visceral fat, they're just like, just liposuction that too. Unfortunately, I can't. It's around our stomach, our liver, our intestines. So that is not possible. And the only way to lose the visceral fat is by diet and exercise. Losing weight is the only way. There's not a surgery to remove visceral fat, okay? So who has more subcutaneous fat or more visceral fat? In general, males tend to gain more weight in the visceral fat distribution. That's why if you put two obese persons, one male, one female, the male usually has a more protruded belly and the female has more like curves, legs, arms. So the distribution of fat in general, again, every person is different. It's more towards the subcutaneous in females and more towards the visceral fat in males. That does not mean that there are females with more visceral fat component and males with more subcutaneous fat component, right? So that is why it's very important to get an evaluation by someone who knows and can tell you what is it that you have more, right? The other easy way of you checking at home is the pinch test, okay? So you just go ahead and pinch your belly, whatever you can pinch, like if you're standing on the side in the mirror and you can pinch the entire thing, you're mostly subcutaneous fat. If you can pinch it, it's in between the skin and the muscle. If you have a big belly and you're pinching a little like this, then the majority of that is visceral fat, okay? So that's like a more, an estimate of what do you have more, okay? So like this diagram shows, the subcutaneous fat, which is the blue, is the one that we can liposuction, okay? When we're doing liposuction, we remove the one in blue. The visceral fat, we don't touch. The abdominal wall, we can tightening with a tummy tuck, okay? So let's talk about the difference between those two procedures. We now know what subcutaneous fat, the muscle, and the visceral fat. So what each procedure does, okay? A tummy tuck It's a procedure that does three main things. One is the muscle repair. So we go and suture the muscle together. With weight gain, pregnancy, our rectus abdominis muscles, which are this, which is the six-pack muscles on the center of the abdomen. This is the belly button here. These are the six-pack muscles. This area here in the center, that's called the linea alba, tends to separate. And with a big weight gain or pregnancy, those muscles, instead of being like this in the middle, they kind of go like this. And we have, with the belly button in the center there, a separation of the two muscles, okay? Even if you work out, even if you try to strengthen your abdominal wall, these muscles will get thicker and stronger, but this separation will still be in the center, and that's what it's called a diastasis. Clinically, how do we see it? Like you're still pregnant. A lot of patients tell me, I work out, I diet, but I still can't flatten my belly. I still look pregnant. And it's because that separation. So the muscle repair, it's basically putting those two muscles back together, suturing that in the center, bringing it back to this, right? Back to the center. What does that clinically do? Flatten the belly and like a corset, bring your waist in and define more your waist. A lot of people tell me, like, after the kids, I feel like I lost my waist. I used to be very thin in the waist, but now I'm like square. It's because of this. The muscles separate and your abdominal wall gets wider and you lose that definition on the waist. So the tummy tuck helps with the muscle repair and defining that waist, okay? Skin removal removes that excess skin below the belly button and tightens that abdominal wall, not only in the muscle level, but also in the skin level. And on top of that, we do liposuction. Liposuction mainly to the flanks or waist area, okay? Common question is, do you go to the back? I don't go all the way to the back, but if you put your arm here on the side, like you're pinching your waist, that's the area basically that I'm doing liposuction with. I don't go all the way to the back, but it covers some of that back fat on the side, okay? Why I can't do liposuction in the center? Because I have to basically elevate the entire skin from the muscle to repair it. That skin blood supply now is relying on the skin and the blood vessels in the center. If I go do liposuction to that area, you may end up having wound healing problems and skin necrosis. So that's why liposuction is safe to do only in the flanks, but not in the center because of that, okay? So that's a tummy tuck. Those three things, basically. A BBL or liposuction is just the removal of fat from the subcutaneous space, okay? So we go back here. It's just the blue part. It doesn't touch the muscle. It doesn't touch that excess skin and tightens everything. It's just a small incision with a cannula, emptying it this, right? What's the important aspect of liposuction is that it relies on your skin elasticity to kind of attach to the muscle and flatten. If for whatever reason, pregnancy, aging, weight gains in the past, you have loose skin, that skin is not going to retract. And I'll show you some pictures of how the belly may look afterwards. There are some cases that I can definitely tell you it will not look good. You'll still have loose skin, and I recommend a tummy tuck. But there are cases that we're in a gray line, right? It may retract. You have good quality skin, but you had a pregnancy. You have some stretch marks. The decision is more on the gray area. Depending on your goals, I'm going to recommend what's best for you, okay? If your goal, and always like the patients tell me, my goal with the BBL is get a flat tummy, and I see some signs of muscle weakness and skin elasticity, I'm going to tell you the only way of getting a flat belly, it's with a tummy tuck. If your goal with the BBL is shaping, adding hips, projection, but you're okay with some loose skin in the belly, then I'm going to tell you, okay, we can proceed with the BBL, but knowing that you may end up having some loose skin. And I want to show you some pictures of what that means, because sometimes people are like, okay, I can have some loose skin and I'm okay with that. But then afterwards, when they do have it, they're not happy with it because they weren't expecting it to look the way that it looks, okay? And again, for everybody's different, but these are the things that I'm referring to when I'm saying you may end up with loose skin. Let's go with the first case, okay? This is the first patient. In her abdomen, I'm gonna move this a little bit so I can be closer, closer to the pictures here. So her main goal was to achieve curves and get hips and more projection. We achieved that, but let's go back to her abdomen. Her abdomen shows signs of stretch marks, which means that the pregnancy had stretched that skin up to the level that the collagen fibers kind of spread too much apart, and that's what causes the stretch marks. She also had a fold of skin. So if you have a fold of skin before the liposuction, you will have a fold of skin afterwards, okay? Because that means that your skin has already been loose before the lipo. The lipo, if you have loose skin, the lipo may make it worse because we're emptying that fat. It's like a balloon was inflated to the max, and then when it goes back, it doesn't go back to the size it was because that stretching has disrupted the ability to bounce back, okay? So stretch marks, fall down here, and also you see the belly button is not perfectly round. When we have loose skin, the belly button is a fixed point in the abdominal wall. So the skin above the belly button tends to fold, or what we call hood. It's hooded, it's kind of going over. You can see it up here. If you have this, if you have that, after emptying all of this, you'll see those signs afterwards, okay? You'll see signs of more hooding on the belly button because that skin over, it's hanging more, the fold down here, and the irregularities, okay? Those irregularities is not uneven liposuction, okay? That is loose skin. Loose skin tends to retract unevenly, trying to attach back to the abdominal wall, but because there is excess skin, you see those irregularities, okay? So that is not uneven liposuction, is loose skin, okay? Again, she's extremely happy with her results. Why? Because she didn't want the big scar, because she says, I wear bikinis and my pants at this level, and my belly up there is flat, and I love my shape. And you can see in the back view, this was her goal, okay? Achieving that more projection on the hips, that hourglass figure. So she is happy with her results. So I'm okay with doing a BBL if you understand then that this is what loose skin may look like after liposuction. If you're okay with this, then we can go ahead with BBL. If you want a flat belly, then the solution is not a BBL, solution is a tummy tuck, okay? Let's go to the second patient. This patient, you see in this picture, is like, she looks great. Her belly retracted, and if you, let me see if I put here, this one. So she doesn't have a lot of stretch marks, very tiny stretch marks just around the belly button, very, very subtle fold at the end, and the thickness of the skin. That's very, very important. You can see here that the skin was very thin, okay? A lot of stretch marks stretched that skin. Here, the skin quality is thicker, okay? That is a sign that the skin is gonna retract better. And she did have a lot of retraction. But the other reason that I put this specific picture on is because social media may alter the way that we see before and afters. And that's a reality. Look at how she's posing. She's holding her breast up and kind of doing like this. The belly's gonna look very flat when you do that. The other thing is that she's wearing an underwear hiding this part. So you can't really tell if she has a fold down here, or if it's hiding it, or if it retracted completely, right? All of those things are important when you're seeing before and afters, because all of those things matter. Because sometimes people see this and they're like, but she had the same belly as me and now I have a little fold down there. Maybe she does, maybe she doesn't. She's a very young patient and that also contributes. She's in her 20s. When we're in our 20s, our skin quality is very good and it retracts better than when in our 30s or 40s or 50s, okay? Another thing very important to consider. This patient, similar to the first one that had already a fold, but she has good quality skin, but a very defined fold and some hooding in the belly button. You can see that the belly button shape is worse than before and the fold is still there, better, it's still there, but the overall shape is great, no stretch marks, so everything is smooth, okay? So she's, again, extremely happy with her results, but she understood that the belly button shape may change, that this fold may not go away completely. She was okay with that, trying to avoid the scar. But one thing that I want to show you is, you see this little lump above the belly button? That's excess skin. That's when we call it the hooding of the skin over the belly button. When you side view, it may look flat here and a little bulge right there. That's just the excess skin, okay? If all those things bother you, then the solution is a tummy tuck, okay? And the last patient I want to show you is this one. This is another reason why this patient, I didn't even offer a liposuction. And some people would say, but she's so skinny. She just needs lipo. Why put a scar on her? She has a very severe diastasis. Her muscles are very, very separated, causing to look like she's pregnant still, okay? This, with liposuction, I don't have x-ray vision, but with my experience, probably she has like this much thickness of subcutaneous fat, the rest of muscle. So if I do liposuction on her after, it's gonna be more or less the same, okay? Because majority of this is the muscle bulging out, okay? So again, depends on what you have, what your goals are, and how your body looks, and your goals. You are gonna decide with your surgeon what's the best procedure for you, okay? Let's take some questions.
Okay. I'm scheduled for a mommy makeover. Can I add arm and chin lipo with face tight?
Yes, that's a very common add-on. Easiest way, check with your coordinator, but it is a common add-on. Arms and chin are areas that, even though you feel are very thick, they don't have a lot of fat. Why do I say this? Because they don't contribute as much to the 1 liter max amount of fat removal that I can do with a mommy makeover. So that's why it's very commonly that I combine them and it can be added, no problem.
Do you recommend a BBL first and then a tummy tuck or vice versa?
Very good question, and that's the part of when to do them. So I always recommend doing the tummy tuck first, okay? Like we talked, the tummy tuck involves the muscle repair and removal of the skin. With a BBL, the problem is that one, I can't do completely even liposuction if the skin is moving at the same time as my cannula, okay? So the best way is tighten everything up and then I can do the liposuction very evenly and smooth everything out. And also, if the muscle is very bulging, that angle of liposuction is not great as well. The other thing is with liposuction, with both, but with liposuction, the amount of scar that forms in the subcutaneous space is all around, okay? So then when I try to do the tummy tuck and like tighten everything up, I can't pull the skin evenly like it was before all the scar from the liposuction developed. Better to do tummy tuck first, 3 to 4 months later, once everything is healed, then we can do the liposuction 360 with or without the fat transfer.
What parts of the stomach do you lipo before tummy tuck?
So before a tummy tuck, like at the tummy tuck, when I do the tummy tuck, it's in the flanks, okay? So when I'm doing the tummy tuck, the skin I elevated to do the muscle repair, and that's basically, this is the chest bone here. So I have to basically elevate the entire skin up to the chest bone, and then I pull that skin down to remove that excess skin, And when I'm pulling it down, now the skin survives from the fat, basically, from the subcutaneous space that has all those blood vessels. If I go ahead and do liposuction to all of that, you may end up with skin necrosis, okay?
Can a tummy tuck and round 2 BBL be a combo successfully, or should a round 2 BBL be separately?
I always recommend to separate both procedures, a tummy tuck and a BBL, round 1 or round 2. The main reasons, two things. One is safety reasons, like I mentioned, skin necrosis when we're doing liposuction. Then you're not going to do a complete liposuction of the abdomen with the tummy tuck because of the risk of skin necrosis. So you're not really doing a lipo 360 if you're doing a tummy tuck. And the other reason is recovery. Okay, to optimize your results and have the best outcome. For the tummy tuck, I'm going to ask you to be hunched over, sleeping in your back with pillows under your legs and back so your hip is flexed. So you're going to be putting pressure to your butt. With a BBL, I want the exact opposite. I want you laying on your stomach to not put pressure in the fat grafted areas. So people tell me about the gravity share, so I can do a donut. So those gravity shares always put some pressure in the hips, okay? And the donuts, all of that put pressure on the hips. So if you want to achieve the best results, better to stage them. First a tummy tuck, 3 to 4 months apart, you do your BBL.
I previously had a tummy tuck and my BMI is now 31. Do you think that's enough fat for a BBL?
I think so. Remember that the tummy tuck didn't do a lipo 360. We're doing liposuction in areas you didn't do lipo before with the tummy tuck. Okay, tummy tuck was only in the flanks area. So with the lipo 360, now I do in the entire center of the abdomen, the back, all the way to the axillary area. So the bra line area, all of that is included. So you shouldn't have a problem with loss of fat.
What's included in a 360 lipo with BBL?
So in the front, it includes the entire abdomen, pelvic area. It includes the flanks. And on the back, it goes to the axillary area. So up to here, the entire back. The only area that is not included in the back is the upper back area, or what is called the buffalo hump. So basically up here, some people have like a little fat in this area there. If you do, that's an added area, but all the areas of the back all the way to the buttock, that's included in lipo 360. Okay, you guys, thank you. Thank you so much for joining. Thank you so much for your questions. I hope this helped answer some questions, and seeing some pictures made you a little bit more conscious about making the right decision for you. And again, if you want an evaluation, very easily go to my page, virtual consultation form, and click on that link, and I'll tell you what to add. Basically, a few questions, send some pictures, and I'll do the evaluation and let you know what's best for you. And I'll see you guys next Tuesday. Tuesday tips. Take care. Have a good week.